Fetal circulation. Fetal circulation refers to the specialized blood flow system in the fetus that facilitates the oxygen and the nutrient exchange via the placenta. Key features of the fetal circulation will be the placenta as the primary site of the gas exchange. Oxygenated blood is supplied by the mother and the fetal lungs remain non-functional in the utero. Shunts to the bypass lungs and the liver. Three major shunts help redirect the blood flow. Ductus venosus bypasses the liver. Foramen ovale bypasses the right ventricle and the lungs. Ductus arteriosus connects the pulmonary artery to the aorta, bypassing the lungs. Pathway of the fetal circulation. Oxygenated blood from the placenta travels through the umbilical vein. A portion bypasses the liver via the ductus venosus and enters the inferior vena cava. Blood enters the right atrium. Most oxygenated blood passes through the foramen ovale into the left atrium, then into the left ventricle, and is pumped into the aorta to supply the brain and the upper body. The remaining blood enters the right ventricle and the pulmonary artery. Ductus arteriosus diverts the blood from the pulmonary artery into the descending aorta, bypassing the lungs. Deoxygenated blood returns to the placenta via the umbilical artery. Umbilical vein carries oxygenated blood from the placenta to the fetus. Ductus venosus shunts the blood from the umbilical vein to the IVC, bypassing the liver. Foramen ovale directs oxygenated blood from the right atrium to the left atrium, bypassing the lungs. Ductus arteriosus connects the pulmonary artery to the aorta, bypassing the lungs. Umbilical artery carries the deoxygenated blood from the fetus back to the placenta. Changes at birth. First breath, lungs expand, reducing the pulmonary resistance. Closure of shunts. Ductus venosus closes, becomes the ligamentum venosum. Foramen ovale closes due to the increased left arterial pressure, forms the fossa ovalis. Ductus arteriosus closes due to the increased oxygen and decreased prostaglandin, forms the ligamentum arteriosum. Umbilical vessel close. Umbilical vein. Ligamentum teres, round ligament of the liver. Umbilical arteries, medial umbilical ligaments. Fetal circulation is adapted to bypass the lungs and the liver. Three major shunts: ductus venosus, foramen ovale, and the ductus arteriosus. Oxygenated blood comes from the umbilical vein, single vein. Deoxygenated blood returns via the two umbilical arteries. Foramen ovale directs the blood from the right atrium to the left atrium, bypassing the lungs. Ductus arteriosus connects the pulmonary artery to the aorta, bypassing the lungs. Ductus venosus directs the blood from the umbilical vein to the IVC, bypassing the liver. At birth, the lung expansion increases the oxygen level, leading to the shunt closure. Prostaglandin keeps the ductus arteriosus open. NSAID, indomethacin help close it. Patent ductus arteriosus occurs when the ductus arteriosus fails to close after the birth. Umbilical vein becomes ligamentum teres and the umbilical arteries becomes a medial umbilical ligaments.